Hello, my name is Lauren,
And I'm Bailey.
and we are UIC nursing students. We're doing a project on tobacco and vaping risk. Smoking has been the leading cause of preventable disease and death in the U.S., killing more than 480,000 Americans each year. The picture on the left shows a vape in the left hand and cigarettes in the right, both containing nicotine. And the picture on the right shows half a healthy lung and then also a bad lung from smoking.
So now we'll begin and talk about hazards of smoking. So smoking and exposure to secondhand smoke can increase the risk of coronary heart disease, atherosclerosis, peripheral artery disease, aneurysm, and strokes. As you can see in the next picture down, this shows the effects that smoking can have on people's lives and how bad some of these risks can end up being. The most prevalent cause for death in smokers is cardiovascular disease. Tobacco smoking is responsible for approximately 22% of cancer deaths. And then we see the picture with the lungs filling up with smoke, and this is just another visual image so people can actually see what happens whenever you put that cigarette to your lips. Lung cancer is the leading cause of cancer-related death worldwide, with approximately 1.76 million deaths in 2018.
So for smoking cessation techniques, this first picture goes over the stages of quitting. So within the first 20 minutes, heart rate and blood pressure drop back to normal levels because, as we know, smoking can lead to high blood pressure. After 12 hours, level of carbon monoxide in the blood drops back to normal. 2 weeks, circulation and lung function improve because smoking causes cardiovascular disease and then also lung problems. After 6 weeks, your energy levels are increased. 6 months, smokers' cough and shortness of breath are disappearing and your lung capacity is greatly improved. And then after a year, the risk of heart disease is half as high as smokers. So nicotine is a chemical that is present in vapes and cigarettes, making them very addictive for users. So once you start smoking, it's often hard to stop. The benefits of quitting smoking, like we said, after 8 hours, there's excess carbon monoxide is out of your blood. After 5 days, most of the nicotine has left your body. After a week, your sense of taste and smell improves. After a month, skin appearance is likely to improve. After 3 months, your lung function begins to improve. At 12 months, your risk of heart disease has decreased by half. After a year, a pack a day smoker saves a lot of money. And then after 5 to 15 years, your risk of stroke has declined to that of a non-smoker. So techniques for smoking cessation include nicotine replacement, such as patches, gum, nasal spray, and lozenges. There's also support groups, mind-body practices such as meditation, and then also alternative therapies for relaxation.
Now we will go on to talking about one of two of our interactive activities. So as you can see here, this is a matching game that we've designed with a few different case scenarios of different patients. So what the learner will do at the health fair will be picking up a picture, and then they will read these scenarios, and out of all of the scenarios, they're going to pick where this picture goes. So as we can see here, lungs of a 52-year-old man who smokes 2 packs per day would match with these black lungs. And then another example would be the heart of a healthy 56-year-old woman who has never smoked before, and that's a healthy heart. So then they'll stick that one there. That's their first interactive activity.
And then for our second interactive activity, we have coffee straws. So by putting the coffee straw in your mouth and plugging your nose, you will be able to experience what breathing feels like for some people who smoke. This is how people with lung disease such as COPD feel like when breathing. They often need to use oxygen at all times to stay alive. So what the learner will do is they'll take a coffee straw and then they'll breathe normally and see how that feels like for them. And then they'll put the coffee straw in their mouth, pinch their nose, and breathe easily. And this gives an effect of a narrowed airway, making it difficult to breathe, like someone who smokes. And that concludes our presentation on tobacco and vaping risks.
Thank you.
Thank you.